This video is a brief overview of TAVR procedure. TAVR stands for transcatheter aortic valve replacement. Within the heart, the left ventricle is responsible for pumping blood through the aorta out to the rest of the body. The aortic valve sits just between the left ventricle and the aorta. Normally, the valve opens and closes, allowing blood to flow out but to not flow back in. Sometimes with age, the valve stops opening properly, in a condition called aortic stenosis. If we were to look from the aorta back at the aortic valve, when it's closed, it would look like this when functioning properly. The three sides all close and meet each other flush. No blood can flow back through. But if we looked from the same view in a patient with aortic stenosis, the valve would appear somewhat rigid, not able to close completely. From this view, you can see a normal valve opens wide, with plenty of room for blood to flow through out of the heart into the rest of the body. But in patients with aortic stenosis, the valve is not able to open fully, and blood flow from the heart out to the rest of the body slows down. The most common symptoms for patients with aortic stenosis include dizziness, fainting, shortness of breath, and chest pain. Mild cases of aortic stenosis can be treated with medication, but almost all patients with severe aortic stenosis will require valve replacement. Traditionally, valve replacement has been done with open heart surgery. However, some patients are too old, frail, or have other medical conditions which put them at very high risk for open heart surgery. For those patients, a successful valve replacement can happen with a much gentler approach called TAVR. Instead of cutting through the chest in open heart surgery, with TAVR, a small rubber catheter is introduced through another part of the body, either the neck, chest wall, or groin. The catheter is passed from another part of the body up through the aorta back towards the heart. Once in place, the new replacement aortic valve is dropped into position. The catheter is removed, and the procedure is complete. Early clinical data shows promising results, especially in patients who would be at high risk for having open heart surgery. There is, however, a risk of stroke after TAVR procedure. Patients should have a discussion with their cardiologist and cardiac surgeon about whether or not they may be a good candidate for TAVR procedure. This is not medical advice. Talk to your doctor before making a medical decision.